Hello and welcome back to CB Talk, the Combined Transport Blackwell monthly podcast. Today is Friday, July 24th, and I am your host, Nick Card, Vice President of Operations. Thank you for sticking with us as we had a little bit of our recess and transition. I want to welcome Ellie onto the team, our new producer. Ellie has taken over for marketing from Tyler. And so Ellie is now here, the new producer of the podcast. And we had to get her up to speed with everything. But now she is on the console glaring at me as I talk about her. That's okay. Ellie, it's great to have you. Thank you so much. So glad that we can put CB Talk back on the air. Today, very special. We have an interview with Mike Card, president of the company. We're going to talk a little bit about the upcoming year. We're going to talk about some industry news. And most importantly, we're going to talk about updates to the health insurance program, what's working, what's not working, and what you guys can expect. But before we jump into the interview, let's talk about the news. In late June, Department of Transportation announced almost $2 billion in emergency funds to repair roads, bridges, and infrastructure. This is on the heels of a number of recent natural disasters that have put significant strain on parts of our nation's highways. And so to see some big money going in to help repair that damage, that's really important to making sure that natural disasters are not shutting down our roadways. We have some new research out in the news. Research group ACT is reporting that 2026 is shaping up to be a supply-driven recovery year for trucking, meaning that we're seeing contractions on the supply side, fewer trucks on the road, fewer drivers, that tightening driver availability, including with non-domiciled CDLs being removed, a number of other things that they're working on, bringing that supply down. We should be seeing increased freight rates. We'll see more demand for trucks. And so that means 2026 is probably going to be the beginning of a pretty strong multi-year recovery for trucking as we finally get past COVID and all the challenges from the so-called recovery from COVID. Safety topic this month is fatigue management. Our focus is on preventing fatigue-related incidents. Make sure you understand your alertness. Make sure you're not driving tired. Make sure you're not driving distracted. It's easy when you're tired to get distracted, to not be paying attention to what's on the road. Make sure you're getting proper rest. If you're not sleeping well, make adjustments so you are sleeping well. That's very important, not only for your health, but for your safety when you're out there. Make sure you're following the hours of service and make sure that you're, again, mindful of that fatigue state so you're not putting yourself or the other motoring public at risk. And with that, we're going to go ahead and jump into our interview. Mike, great to have you back in the studio today to talk on the podcast. I know whenever we get you on here, usually you are our most popular guest. So appreciate having you back on. I know something we were talking about before we started recording was some of the changes that we're sort of seeing as we look ahead to 2026, some of the supply side issues. And I know there are a couple issues you wanted to bring up that I thought were really interesting. So if you kind of want to take it away and sort of lead into what you want to talk about as we look forward to 2026.
Well, thanks a lot, Nick. And I am happy to be back on the podcast. I love doing it. I think it's an excellent tool, service for our drivers and other people that listen to it. So it's an honor and a privilege to be able to be back on CB Talk. I do want to talk about the industry in general, what I see moving forward. Primarily, I want to talk about our health insurance today, but there's been some things in the news that I thought I would talk about first. And that is the capacity issues in the trucking industry. We're starting to see capacity finally start to leave the industry. I saw where the state of Ohio is revoking 5,000 CDLs for non-domiciled worker. I heard about another accident where a non-English speaking driver in Ohio just killed a star soccer player. So it's good to get those unsafe actors off the road. The non-domiciled CDL issue looks like the DOT is getting its arms around it. There's still a lot of illegal CDL mills, but I see a kind of a light at the end of that tunnel. I see that they're working on getting rid of some of these ghost fleets. And recently, I saw where the DOT has revoked 5,000 visas of Mexican carriers that were illegally hauling freight in the United States. Between points in the United States, it's called cabotage, if you've ever heard that term. But that will eliminate a lot of capacity, a lot of trucks out of the southern U.S. They're also looking at Canadian carriers that are hauling freight illegally inside the United States. So I really see a lot of capacity leaving the industry, which should help us see higher freight rates and help our company become more profitable.
So just to make sure that listeners understand, so cabotage is the principle that if you're a Canadian or like a Mexican carrier, you can haul freight from Canada to the US or the US to Canada, or vice versa with Mexico, but you can't come into the US and then haul stuff around from US to US locations.
Correct, Nick. And that's what they're doing. They're hauling illegally between Dallas and Phoenix when they can only do Dallas back to Monterey or things like that. One thing, I interview all of our drivers. We have an informal talk every Wednesday with all new employees, new drivers. And one thing I'm hearing a lot of lately, I want to talk about today, is 1099 workers, 1099 drivers. And for those of you that don't know what that term means, 1099 is what you give to a contractor. If you have someone working for you that's not an employee, you give them a 1099. Like our CPA, I give him a 1099. It means he's a contracted vendor for our company. We also have owner-operators that own their own trucks and trailers that drive for our company. Those are also 1099 contractors because they own their own equipment. They have their own business name. They are business people. But what is illegal is when you pay a driver as a 1099 contractor. And I'm talking to our drivers. A lot of these some of our drivers have worked as 1099 employees, and they really didn't understand the repercussions of being a 1099 employee for a trucking company. They just thought, wow, it looks like I'm getting paid a little bit more than I would working as an employee. But as everyone should know, 1099 employees don't get health insurance. They don't get workers' comp. And there's no taxes taken out for employment taxes or Social Security or any taxes. So at the end of the year, a lot of these 1099 employees are getting called by the IRS and they're owing a lot of money and they're getting in trouble with the IRS. And so what it's basically 1099 drivers are getting ripped off. And it seems like they might get paid a little bit more, but they're actually getting paid a lot less with no benefits and no taxes taken out. And they're just getting themselves in trouble. So I want to warn everybody out there that's listening, please do not become a 1099 driver. It's illegal, first of all. But secondly, they're ripping you off. You got to compare the whole wage package when you choose an employer. And so I think we've got to get a lot of these 1099 paying trucking companies out of the industry as well. So I think that's something the DOT needs to focus on, Nick.
When we talk about these 1099 carriers, a lot of these are these smaller carriers. They're not safe operators. They don't have quality equipment. They're small companies they're really undermining what it means to be a truck driver, what it means to be a safe carrier, the kind of standards that I think we set as an industry. And so it's just one more way that these guys put the public at risk. And that's through, not reporting the taxes and all that kind of stuff.
And it's basically hurting our drivers because we can't compete price-wise with those companies that shirk their responsibility when it comes to safety or paying their employees.
Insurance, being uninsured
Yeah.
carriers out there.
And these are the same carriers that force these drivers to cheat on their hours of service, and they charge these drivers to get more hours, and they expect drivers to deliver loads that they can't legally deliver. And these are the really bad actors in the industry that the DOT must get rid of for us to have a good industry.
Mm-hmm. Yeah. So do you think that as we're seeing those changes, I mean, because you had mentioned DOT sort of getting its arms around this, the non-domiciled CDLs and this cabotage, do you think that's going to continue to lead to additional supply side sort of removal of supply out of the industry? Is that coming?
I think you see it in spot market rates, Nick. We're seeing spot market rates go up again, thank goodness. We're seeing spot market rates as high or almost as high as back in the post-COVID days. So you can tell that shippers are finding it harder to move freight. I know that when we broker a load, it's still a struggle for us to find a good carrier to broker our loads to. But yeah, the capacity is leaving. Spot market rates are going up. And I really see that if we get any kind of a demand increase, which we really haven't seen, a huge demand increase in glass and construction, wood products. If we started to see a huge demand increase, Nick, I really think that we'd be a lot more profitable, and you'd see rates really rising. And that means more pay for drivers too.
So if I made you pull your crystal ball out of your pocket, what do you see for the second half of 2026 and beyond?
Well, there's a lot of what ifs, and I know we're here to talk about health insurance, but what is going to happen to the Iran war? These fuel prices are really hurting us still. We need to see our fuel prices get below, back to normal, whatever that is, but about $1 a gallon cheaper would be nice. They're still not talking about reducing interest rates, even though I don't think inflation is that far out of control. I think it's more of a unique kind of energy hit. But if we can see a demand increase, which is 50-50 for the second half of this year, but I think next year for sure we'll see an increase in demand. We'll have a tighter capacity. Probably won't see a lot of real growth in our industry, Nick, as far as more trucks on the road from the good carriers until 2027.
Okay. All right. Well, let's change gears, because I know the reason we wanted to have you on and was to talk through the new health insurance program. I know there have been a lot of questions that you wanted to address, and I want to make sure we have enough time to go through those. So I think just to start it, we'll open it up with, I know we've got the new health insurance plan. What are some of the changes that have come through that? What are some of the issues? What are you looking at? And what is the combined team looking at as far as how do we make sure that we're continuing to deliver healthcare for our employees?
That's exactly right. That's what we want. We want to have a good healthcare program for our employees, Nick.
Yeah.
All right. So let's talk about our health insurance. It's a brand new program that we started February 1st, as you know. We had Providence Healthcare. They have since gone out of business. That shows you the challenges that we have in choosing insurance programs. But we have Imagine 360 now. I know a lot of you had not heard of them before this, but they are a very service-oriented, excellent program for us that I've seen so far. But there's a challenge with working with Imagine 360. As some of you know, they're a reference-based pricing model, and we're going to talk about some of that. But let's talk about kind of what I've seen through the first 5 or 6 months of the program, Nick, our health insurance program. So, when we do an open enrollment, everybody gets welcomed to the plan. There's a lot of unknowns. Who do I sign up? How do I sign up? What do I need to do? That whole month of January, we're trying to get everybody signed up. The whole month of February, we're, oh, my doctor doesn't take this program. How do I get my doctor to take it? We spent the first month or two reaching out to doctors' offices and facilities to make sure that they understood how Imagine 360 pays. And there were some bumps in the road. Some people said, oh, well, you don't take it, right? You walk in, no, we don't take it. And it takes a while to talk to your doctor and to prove that they're a good program. And so now, 5 months into the program. We've gotten beyond that. I think everybody's got comfortable with the program. There might be a few providers that are still fighting us on it, but I know me personally, all my providers here in Southern Oregon have taken Imagine 360. Some have grumbled about it, perhaps, but so far everybody has taken Imagine 360. And so now that we've got past that, and if you still have a problem, please reach out to Human Resources because they should all take Imagine 360. So now that we've got past that, now we're starting to see the second phase, the second group of problems when you have a reference-based pricing model. And I'm going to remind you real quick what a reference-based pricing model means. So when you go to the doctor and you have an x-ray, what does the doctor charge our program for the x-ray? Well, you only have to pay your copay or your deductible, but the doctor's office can basically charge us just about whatever they want, and that's what they do. So this x-ray, if you're on Medicare, let's say it would only cost $100. That's all the doctor's office could charge. Well, reference-based pricing models will pay the doctor 120% of Medicare or 20% over Medicare. Even though the doctor might charge us 200 or 300% over Medicare, all we pay is 120% over Medicare, which is 20. So the reference-based is the reference to Medicare, and it's a 20% over the base. So that's what a reference-based pricing model is. So your doctor or your facilities are making more than Medicare, and maybe they don't get as much as they like to charge a private program, but that's the way we pay. And so far, we've had very little pushback from the doctors in the hospitals. We get a report every month from everybody's charges from all these doctors, and we've only seen a couple of issues. In fact, I had one, Nick, so I'd like to explain. I did a procedure where I had to have an anesthesiologist. Well, the anesthesiologists here in Medford have their own program and they want to charge whatever they want to. So they billed our insurance program almost $1,000 for their anesthesia. According to Medicare, it should have been $150. And so we paid the anesthesiologist about $200 is what they paid. And so the anesthesiologist complained to me. They sent me a bill for $600 or $700, and they said, you have to pay this, Mike. And that's what's called a balance bill. All right, so I want everyone to understand that you might receive a balance bill from one of your doctors. And you don't pay, and let me repeat that, you do not pay balance due bills. Before I get into how to handle it, I want to remind you all that you get an EOB, which is called an explanation of benefits. Every time you see it, go to the doctor, you get something mailed from Imagine 360, and it's called an explanation of benefits, EOB. I'll be using that term a lot today. So your EOB will explain to you, it shows you what your doctor charged, what Imagine 360 said was an eligible charge, and what they paid off of the original bill. And if you owe money because there's a copay or a deductible, there will be a charge on your EOB that says, yes, this is what you have to pay. So you should pay what's on your EOB, your explanation of benefits. But you do not pay your bill from your anesthesiologist. Okay? So I got my EOB from my anesthesiologist, from Imagine 360, and it said, all you have to pay is your copay, and we're only going to pay your anesthesiologist $200. So that's what so I did my copay, that's all I did. And then I get this bill from the anesthesiologist. Hey, you owe us $600. And so there's a procedure you're supposed to follow when you get a balance bill. First of all, you do not pay it. There's a website, or there's an email, excuse me. There's also a website, but there's an email. I want you to write this down. It's very simple. It's BB, balance bill, BB at imagine360.com. If you get a balance due bill and remember, it's not your explanation of benefits. If you get a bill from a doctor's office in any form whatsoever, you don't pay it. You wait for your EOB, and usually you'll get your EOB before you get this bill. But anyway, you get an EOB, you pay your EOB bill. But if you get a balance due bill, do not pay it. Take a copy of it, email it to bb@imagine360.com. Or if you don't have a scanner, or if you don't have a way to take a copy, take a picture of it with your phone. But anyways, send that bill to bb@imagine360.com. And what Imagine 360 does, and they did a great job for me, I got an immediate advocate who responded to me within 24 hours. That's what they promise. They will respond to you within 24 hours with this advocate. And this benefits advocate will take over and contact your anesthesiologist or your balance due bill doctor or facility. They'll contact them and they'll find out, hey, this is what we pay. They'll negotiate it. Because remember, this is how we can keep our costs down. We want to fight these kind of bills. Help us fight these bills, because these doctors get away with charging us whatever they think that they can get away with. So don't pay it. Let Imagine 360 negotiate with these people. So what happened in my case is Imagine 360 reached out to the anesthesiologist and said, hey, come on, we're not going to pay you $600 for something that's $150. We'll give you another $50. And they offered him $50 more, and they agreed to take that $50, not the $600. We paid him $50 more. I didn't. Imagine 360 did. And what's funny is I got a phone call from these people demanding that I pay $600. But I said no. Imagine 360 is handling it. And pretty soon I got the signed agreement and everything's done, so I didn't have to do anything. Let Imagine 360 negotiate this stuff. That's how we can save money on these doctors and facilities trying to rip us off from charging whatever they want. And they do. I've talked to the local hospital, and they said, 85% of the people are on Medicare or Medicaid or Oregon Health Plan. And so the only way we can make a lot of money at the hospital is we charge our private insurance companies whatever we want. Ha, ha, ha. Well, I don't like that, and I don't want to pay whatever they want. I want Imagine 360 to fight for me and fight for our company and not pay them more than they need. So let's recap, okay, Nick? 'Cause I know I've just thrown a lot at you. First rule, don't pay balance bills. Only do what your explanation of benefits, your EOB, says. Got that?
Yeah.
Okay. And as soon as you do get a balance due bill, don't just throw it away. Don't ignore it. Email it to bb@imagine360.com, or pick up the phone and call Human Resources here, or send it to Jen, our HR here, and she'll send it off to you. But it's quicker if you do it directly to Imagine 360. They'll reach back out and they'll stay in contact. And you know what, people? It may take a long time to negotiate these things. So you may receive more than one balance due bill. You may get a threatening balance due bill. And hey, they're going to say they can do this or they'll do that, and they'll send these nasty bills, or they'll even call you like they called me. Still tell them, no, Imagine 360 is negotiating this. They're handling this. I'm not going to. And I want to assure you that your health bills do not affect your credit. I know a lot of people are out there like me. I've never not paid my bills, right? I have a good credit. I don't want my credit to be ruined because my company doesn't pay their health insurance. They do not and cannot affect your credit with health bills. That's a law. And people will tell you different, but the law is you cannot get your credit ruined because you don't pay your health bill. But you've got to make sure you get that to Imagine 360 so they can acknowledge that and they can work with their provider. But if you ignore it and it goes to a collection agency, the collection agency will go against your credit. So they can't take it to a collection agency if you give it to Imagine 360. Does that make sense, Nick?
Yeah.
Okay.
I think one of the points too that I think it's, I as I'm listening to what you're talking about with reference-based pricing and all that kind of stuff, the thing that stands out to me is why I think this is really good is that when you think about what you pay every year, I think about my own medical expenses. My deductible, what I have to pay is a percentage of the treatment that I get, where I go. If that is the $1,000 or whatever that they want to charge me for whatever, because they can get away with it, I'm paying a percentage of that $1,000. If we can get that down with this reference with Imagine 360, that means the percentage I'm paying is a percentage of $200, not $1,000. And that's a lot of money that it's not coming out of my pocket for my medical care.
Yeah, you're exactly right. I had a driver that twisted an ankle or something and had to go in, got an MRI on his ankle down in southern Utah wherever it happened. It was over $1,000, right? And his deductible is $750. Well, Medicare for that same thing is $150. So when we only paid $150 of it, plus 20%, his deductible was only $150. So we just saved him $600 off his deductible that he didn't have to pay. So you're exactly right. This will directly affect our employees' amount of money that's out of their pocket. But overall, it will really, I got another example with facilities. And really, I'm not trying to rip off doctors. I think doctors are great and we need doctors, and I'm not trying to upset doctors at all. And they're not really the ones that charge the most to the program. We try to be fair with doctors. But these facility charges, oh my gosh, we had, this poor driver was down in Fresno. I won't even tell you what he had to do, but it was a $250,000 bill that we received.
Wow.
Yeah, for this one procedure for this driver. And Imagine 360 paid $45,000. And so while the driver, he had to pay his deductible, right, and his percentage, but he's going to probably hit his max out of pocket. But it saved the company over $200,000. Those are huge savings that if you think about that over the course of a year, that's how we can afford to provide a good health insurance program. That's how we can, stay in business, because if we couldn't afford health insurance otherwise. And so, having a reference-based pricing, there's some challenges with it. There's balanced dues. There's negotiation. There's some people don't like it, but it's really a way to save the company money and the employee money, and to continue to have a good health care.
I know with hospitals, I've seen the horror stories of hospital billing where it's like you use Kleenexes in your room, so they charge you $50 for a box of Kleenexes, or oh no, you needed an extra set of sheets on your bed, so that's $300 for a sheet change. And oh, God forbid you wanted a bottle of water next to your bed, that's a $15 bottle of water. And it's like all of these charges that add up so fast that are just ridiculous, unfair charges that come out of these facilities for everything that nickels and dimes you because they can get away with it. Having somebody like Imagine 360 to fight that, that's a good thing.
I want to add one more thing to what Imagine 360 does. I want to let you know that if you're having trouble paying your deductibles or paying your co-pays or paying your medical bills in any way whatsoever, Imagine 360 has a program called Upland Advocacy. And if you reach out to Upland Advocacy, which is a part of Imagine 360, they will help you pay your bills. There's money out there that facilities have to help people pay for their bills, especially if they're over $500. So if you need any help whatsoever with paying your EOB portion, you only pay your EOB portion. But if you have troubles paying your EOB portion, reach out to Upland Advocacy. There's a phone number. I'm going to give it to you right now. And Jennifer, our human resources manager, has this. It's 833-9-UPLAND, UPLAND, 833-9-UPLAND. There's an email address, support@uplandadvocacy.com. So this is another service that Imagine 360. If you are having trouble making that deductible, making that copay, doing that max out of pocket, reach out to Upland Advocacy. It's free, and they'll try to get you money to help you pay your medical bills.
That's a very good service.
Yeah, I thought so too. So, any other questions about insurance or balance bills or EOB?
I think I just, what are you seeing as terms of like people who are, having issues so far? You'd mentioned we've gotten through most of the sort of facilities don't want to take this insurance because they don't understand it. We got through a lot of that, but is it really the primary concern is the balance due bills, or are we having other kinds of issues that are coming through the door around the health insurance program? Any misconceptions that maybe or challenges that you're seeing?
Well, I haven't heard a lot of problems since the first couple of months with, my doctor doesn't take this. We did have a lot of bumps in the road with that kind of thing. And I'm afraid, and I want to stress that you shouldn't postpone your health coverage, your health care. It's important. You do your preventable care. You do your prescription correctly. You see your doctors like you should. Don't postpone your health care because you're struggling with, or they're struggling with Imagine 360. We've even paid directly with our credit card to a provider more than once that refused to take Imagine 360. So we said, what's the cash price? And we paid them credit card right then and there because we think our employees getting their health care is very important. So don't let a problem with Imagine 360 or health insurance or anything cause you to postpone your needed health care. So I hope that hasn't been going on. I haven't heard about that, Nick. And I've heard most of the time that since after the start, most people have worked out the kinks about getting their providers to accept this, especially in Southern Oregon. I think it's becoming more well known. But if there are people that are still struggling, please reach out to us, reach out to Human Resources. But normally what happens, Nick, that's why I think this podcast is really important with a reference-based pricing program like ours. Bills take a long time to go through the system. So we only first started to have services in February and March. And so you figure 90 days, 120 days, the bills are starting to come in, bills are starting to get paid, and balance dues are starting to be digested. We're going to start seeing more of these balance due bills, now that's 6 months into the program. That's why the timing of this podcast, I think, is important because probably from now moving forward, we're going to see more of these balance due bills. So I thought I'd head it off at the pass. Don't pay the balance due bills. Only follow your instructions on your EOB. And if you need help making payments, reach out to Imagine 360, Upland Advocacy, and don't forget bb@imagine360.com for your balance due bills.
So if employees have questions, there's uncertainty around this. Because I know we're just sitting here talking as a podcast. What's the best place for people to reach out if they have questions or concerns?
Well, Jennifer does a great job here as our human resources, and she answers a lot of questions. Yes, we have 400 employees, and it's a lot of phone calls if everyone calls in. But you can feel free to call her, or there's the My Benefits portal. Imagine 360 has a website called My Benefits. And so it's a website. Let me give you the address, please. It's mybenefits.imagine360.com. And my is spelled M-I. So mybenefits.imagine360.com. And that's, you can do a lot of things on that website. You can send in your balance due bills on that website. You can answer questions. You can see your claims. You can review your EOBs online. You don't need to call, but if you want to just reach out, there's a lot of information. There's a lot of support on mybenefits.imagine360.com. And you don't have to wait on hold to try to get somebody on the line with Imagine 360. Although I have waited on hold and they do pick up and they do handle it very well. But sometimes they're busy. So going on to mybenefits.imagine360.com really is a slick way of doing it. If you have a bunch of questions and you're really not even sure where to begin, that's a good spot to go, Nick.
Okay. Anything else related to the healthcare program that you want to touch on?
Oh, one other thing. I think, like, obviously the website is available 24 hours a day, 7 days a week. Calling in, I think there's limited time, 6 a.m. to 6 p.m. So if you're trying to call in after hours, there's no one that's going to answer it. That'll be frustrating. So that's where you can go onto my benefits. But I think 6 to 6 or 6 to 5, I don't know the exact times, you can call in directly to Imagine 360. And I don't think I have that phone number handy. But anyway, but I think going on the website is probably the slickest way to go. So, I think the first year of a reference-based pricing program is the biggest struggle, Nick. So talking about next year, 2027, hopefully we keep Imagine 360, because it was kind of bruising to get everybody up and running. It should be a lot smoother. And if we're saving money, we lowered everybody's monthly payments by $10 in 2026. I'm hoping we can lower people's expenses for 2027 as well. If this program continues to work as well as it is, and everybody pulls together on this, I think this is a way that maybe even in some cases where we can get to $0 copay for certain providers. I'm looking at doing our own shared clinic with other businesses in Rogue Valley. We're trying to find ways to lower your healthcare out-of-pocket costs and still providing a good product. So if this program works as well as it's doing so far, I think that's something that's on the horizon for everybody.
That's good. I know health insurance costs continue to rise across. It's been a constant drumbeat. They've outpaced inflation for probably the last 10 or 15 years. And healthcare costs are now a big portion of everybody's expenses. And so if this is the kind of program that can help us reduce those costs, that's really good news.
Yeah, that's great news. And I just want to thank everybody for their patience and working with us to get Imagine 360 up and running. And I think it's a good program.
Any other sort of changes to benefits that we anticipate as we're going through the next year or two? Or is this sort of, we got through the bruising portion and now it's full steam ahead, assuming we can make it work?
Yeah, I think trying to get a good program on the health insurance for everybody is critical. Our driver pool is getting older. I'm getting older. So we're starting to see a lot of hits to our health insurance programs. So we want to make sure we have a good health insurance program for our long-term employees, our older employees. And, I think it's, when we talk about 1099, they don't have any health insurance. And when you're young and you think, I don't need health insurance, but everybody needs health insurance. It's a way to protect yourself, protect your family. If you get sick and there's no health insurance, you've lost everything you've built. And so, don't be a 1099 employee. It's illegal and it's not good for you. You want to have a company that cares about you and provides good health insurance. So, yeah, I think having and keeping a good health insurance program is a key priority for us, Nick. So that's what I'm going to focus on.
Excellent.
All right.
Any last thoughts about 2026, about the future? Anything else you want to share?
Well, let's be safe. Number one rule is keep everybody safe, keep the rubber side down, and keep working hard for us. I appreciate all the drivers out there, Nick.
All right. Thank you, Mike. It's good to have you on again.
And thank you.
Thanks again, Mike, for the interview. Great talking to you about healthcare and the industry. Good conversation as always. Our next episode will be out on August 28th. Yes, we will continue working unless Ellie abandons me and CB Talk. I'm getting the glare again. If you have questions, as always, send them to us via Facebook or email at cbtalk@combinedtransport.com. We appreciate your participation. It's your engagement that makes this podcast work. Thank you for your time. Thank you for listening. And thank you for being a part of the Combined Transport team.